Hello, everyone. Thanks for joining us this evening. It's Matthew Maynard speaking, and welcome to the final webinar of 2017 for Hemophilia Ontario. And this evening, we have Jenna Foley, who is our Executive Director, Amy Griffith, Board Member, and Maya, our President, who will be speaking about the 2017 engagement strategy and the subsequent 2018 program plan. You'll notice over on the right-hand side of your screen that you're able to both speak up, but also you can make use of the chat window. For those of you that have any difficulty, you can feel free to call me directly, or you can message me. And on the screen, I'm Hemophilia Ontario. I think with that, unless anyone has any questions at the moment, we'll get started, and I'll turn it over to Jenna.
Thanks, Matthew. Welcome, everyone. Thanks for joining us this evening. As mentioned, my name is Jenna Foley. I'm the Executive Director at Hemophilia Ontario for about a year now. And tonight we'll be reviewing the process that we've taken to engage with the membership over the course of that year, some of the feedback that we've received, and some of the direction that we've taken as a result. Actually, I think most people on the call would know a little bit about me, so I'm going to turn it to Maya and then and ask if they'd like to introduce themselves a little bit.
Hi, I hope everybody can hear me. So my name is Maya, and if I haven't met you before, I hope to get to meet you in person at some point, but welcome to the webinar. And I'm just happy to be a part of this today and hopefully help to answer any questions if anyone has.
Did you want me to go right away? Okay. So I'm Amy. I'm on the board alongside Maya, and yes, we've just been going over a lot of these strategies and outcomes very recently. So it's really nice to be able to share it with everyone, and again, just answer any questions or clarify things for people in real time.
Thank you. So just an overview of an agenda for the evening. We're going to start by looking at the engagement process overall, and then the three main components, and then a little bit of a summary for what we've heard. Then we're going to look at our program plan for next year, again, an overview. Then we'll dive a little deeper into the regional programming. We'll look at the provincial programming, and then Amy's going to address a little bit about the vision and process that went into some of the decisions that were made. And then, of course, we'll open it up for any questions anyone has or any discussion that we'd like to have. So diving right into the engagement process, we wanted to hear from you, and we really did this year. It's really important for us to recognize the changing membership, both in terms of the demographics and of the priorities, as sort of treatment has changed over the years, as Hemophilia Ontario as an organization has changed over the years. And we really wanted to make sure that we were being as effective as possible with the resources that we have, and that we were being responsive to the needs of the community. That's really what we're trying to do.
Jenna,
so,
sorry, Jenna,
yeah.
It's Matthew. Your slides are not progressing.
Oh, but they're progressing on my screen. Oh, I don't know why they're not progressing on your screen. Okay. Are you seeing these now when I'm doing it this way?
There we go. Yep.
Okay.
Thank
Sorry
you.
about that. Okay, so you missed all of these slides that I had. And now we are at the brief engagement overview, putting it into some context. So when we started this at the beginning of 2017, you had a brand new executive director who was really focused on getting to know the members, both individually and as a community, to really get a better understanding for what the general feeling of the membership was, what the priorities were, what people would see, and being able to reestablish some lines of communication that maybe hadn't been used in recent times. So when I came to the organization, it was an environment where we had some declining event participation, that we had been running very similar events year after year. We weren't getting the numbers that we used to have participating. And a lot of questions related to what some of the goals of the events were, related to undefined outcomes. What's the actual impact of what we were achieving? Did we even know what impact we were trying to have? And all of this is taking place within the context of shrinking revenues and having fewer resources overall. So we went into the engagement process really trying to answer the question, how can we be the most effective, efficient, and impactful organization possible? So we started out with the Social Summit, and I'm going to ask Maya just to maybe give a little bit of an introduction to what that event was.
Sure. Hello. So we had a social summit following our AGM this year, and it was a really great opportunity for people to sit around more in a social setting and go through kind of, you know, the good, the bad, what needs improving, what we're good at with Hemophilia Ontario, and any new ideas that people thought that something we could maybe be considering for in the future. So like I said, it was just in a social setting after our AGM, which was great for people to connect and have some open conversation about those types of things. And so we came away with a whole bunch of good ideas and have been beginning implementing those.
Thanks, Maya. So as Maya said, we were looking for feedback in 3 general areas, and the event was structured in a way that people could have whatever conversations they wanted to have. They could raise whatever issues they wanted to raise, and really put forward what they thought was most important or wanted to have reflected. So in terms of what we saw for good news, things that were already working well, it fell into 4 general categories. The first was comprehensive care. Basically, the feedback was that we had a really strong focus on programs and education, and people were really happy with the quality of care that they were receiving. Camp is something that comes up again and again whenever we talk about what's going well. People are really responding to the opportunities for kids to learn self-infusion, to have that time to, just be a kid, to meet other children that have similar life experiences. So that was a positive. Involvement came up under good news as something that was going really well in terms of seeing more volunteers, new voices around the table. There were comments about the positive impact of having more women in leadership roles. And then a lot of comments as well about responding well to the overall engagement process, that they liked the idea that there were going to be opportunities to connect with the membership, and that the organization was open to receiving whatever feedback people wanted to share. And in terms of opportunities, there were some good news pieces about new partnerships that have been developed, and some use of online technology that was a little bit more user-friendly. When we looked at the feedback we received around needs improvement, there were a couple of comments about clinic attendance, just mostly a lack of visibility for Hemophilia Ontario as part of the clinics, and then also some outdated materials. The website was mentioned many times, just being out of date and not very user-friendly. Engagement came up as something that really needed to be improved, both in terms of seeing more programming for local communities, reaching out to new families and expanding the membership, and then how do we support families, especially at time of diagnosis. Further comments around needing improvement was advocacy, so that we could be doing a better job of advocating for care and treatment, that it was important for us to focus on sustaining product availability, and then also creating more awareness about women's bleeding disorder care. They felt, but some of the feedback that we received was we could have increased education, particularly in terms of video and webinar resources. We'd like to see some improvement in our relationship. So there were a couple of comments related to CHS. And actually at the social summit, most of the feedback we received in that area was more about not having an us versus them attitude, more about trying to find ways that we can work better together. And how can we create ongoing connections to campers and their families. So that's related to some ongoing conversations and dialogues around Wanakita and how do we engage campers that we send to that program. And then other things that needed improvement that didn't really fit in any of those categories were maybe a lack of data collection, and as I mentioned earlier, some of the impact assessment and outcomes measurement, and then outreach and education needed both to emergency departments and then to the general public, raising awareness overall. When it came to discussing new ideas, these are things that they would like to see Hemophilia Ontario doing that it's not doing right now. So research was mentioned multiple times to engage in some patient-oriented research projects. There were a lot of ideas around fundraising. So starting some province-wide initiatives, looking at third-party or innovative events ideas. I think something that came out of the social summit was the idea about doing cooking classes as a fundraiser, and looking for some new sponsorship partners. They'd like to see some new programming, so particularly programs for moms and girls was mentioned, and then doing some outreach to parents at camp. And then engagement came up as something that is a new idea. So how can we look for new ideas related to youth engagement and recruiting board members? So we moved from the social summit to the online engagement survey, and I'm just going to ask Amy to give a bit of background about that.
Okay, so hopefully some people on the call will actually have been participants in this survey. So the survey was very widely publicized in a number of places on our social media through Blood Matters, in some places also advertised in clinics. So the idea with the survey was to get as many members as possible to engage, and it wasn't quite as in-depth as some of the other initiatives we took. I don't know if Jana mentioned the focus groups yet, but that was a little more detailed. This was a general overview, and the response rate was quite good as well. As you can see from some of the information on the next couple of slides that are going to come up, there was a lot of very positive feedback. 85% out of the 99 that responded were Hemophilia Ontario members, and we had a very good overall rating affecting our programs that reflected the needs that the people who responded that they thought their family needed.
Great. So part of the questions that we asked through the engagement survey were, could you rank our programming? So we asked people to rank the most valuable, the second most valuable, and the third most valuable program that Hemophilia Ontario offers. And these were the top 5 answers between the 3 rankings. So when you look at their total number of votes, these were the top 3 answers. You can see the top 3 programs by a significant margin are summer camps, local education, and community camps. Just the guys and local social events being 4th and 5th with a very close score. As part of the online engagement survey, we also asked people to complete the following sentences. So the first one was, Hemophilia Ontario makes me feel. And we received a number of positive responses. 17 responses were some form of makes me feel as part of a community or makes me feel connected. We had 9 people who said Hemophilia Ontario makes them feel informed or educated, 8 empowered or hopeful, 5 said welcome, 5 said supported. But there were a number of, I don't want to call them negative, but maybe responses that indicated we had some work to do. So, for example, ambiguous, ashamed, at a loss for what I can contribute. 2 people said frustrated, 1 said neutral, sad, undervalued. 2 people indicated that they were worried. The next sentence we asked was, I wish Hemophilia Ontario would. So far and away, the most popular response was to have more local programs. 7 people said some form of to keep going or keep doing what you're doing. 6 people were more education. 4 people were more awareness. 3 said to examine the relationship with CHS. And in this case, the feedback is a little bit different from the social summit, where the social summit was more about not us versus them. On the online engagement survey, it was a lot of examine our independence and the need for a bigger voice within CHS. But we also got a wide range of like unique or one-off answers. So for example, there were specific requests for programming related to aging males, to women and girls, requests to remove gender-specific programming altogether, requests for programming related to employment, and then general need for better communication. And I wish Hemophilia Ontario would find a cure, and I wish that too. So the last sentence we asked to be completed were to name the top priorities for Hemophilia Ontario in the next 1 to 2 years. And again, this was an area where we had a really wide range of responses. So I couldn't put all of them, but I put the ones where there were more than one response in that area. So to build membership and communication and research were both the most frequently given answers. Then awareness, fundraising, local education opportunities, youth involvement, and 2 individuals indicated the need to regain member trust. So from the online engagement survey, which gave us, I felt, some really strong background information for what the membership wanted, we took the feedback we'd received to date, because the survey was opened in March of 2017, and it's technically still open, but we haven't had any responses since October. So from March to October. But in the middle of that, we ran a series of focus groups that took some of the feedback we had received to date through the online engagement survey and just delved a little bit deeper. There is a full report that's available. I'm not going to go through the full report right now. It's about 26 pages long, but if anybody would like to access it, it's available at hemophilia.on.ca, or if you get in contact with me, I can send it to you directly. Basically, the focus groups happened over the course of the summer. It was advertised in Blood Matters through the engagement survey, if people filled it out before the summer. And then we also sent multiple distribution list emails about it and made several social media posts. It ended up being 11 sessions. We had originally scheduled 27 across Ontario, but in order to sort of respect the time involved and also the cost related to travel, it was decided that you had to have a minimum of 4 participants in any one location for the session to proceed. And so that's why we had 11 of the 27 proceed. All regions ended up represented except for Northern Ontario. We did have 5 dates and locations scheduled in Northern Ontario, but we only received 1 registration total for the entire Northern region, so they were all canceled. Interestingly enough, I felt that the successful locations for the focus groups were not the same as our traditional service areas. So for example, the SWAR region has always been very involved around London, which makes sense, that's where the clinic is. But the London focus group was canceled due to a lack of registration, but we did have successful groups that were held in both Woodstock and in Windsor, which were really positive. We also had a group in Tecumseh as well. And similarly, we had to cancel Hamilton due to a lack of registration, but there was a very active group that participated in Kitchener-Waterloo. So it's just something for Hemophilia Ontario to keep in mind as we move forward with local programming, that local programming might not mean where the clinic is located. We had 38 total participants, and it was very diverse, as young as 15, as old as over 70. I didn't actually ask anybody how old they were. And we had a mix of current members, people who have been previously involved and are no longer involved, and then there were also people who had never been involved before. We also had a mix of people who were directly affected and parents of young children who are affected, and people who were just involved in the community. We started with 10 questions, and I'm just going to go through them quickly. I don't know how interesting this is to people. If you have any questions at any point, please feel free to ask. But just looking at the people who have registered for the webinar, I think actually most of you were involved in the focus groups, so you would be familiar with these questions already. But we did ask people what their fondest memory of Hemophilia Ontario was. And so there was a lot related to specific programming, especially summer camps, a number of answers related to advocacy and community building around HIV, HCV, and the tainted blood tragedy. There were answers about Christmas parties and other social events, and just general education opportunities and the chance to be involved. Oh, sorry. We asked people to rank Hemophilia Ontario in recent history on a scale of 1 to 5, where 1 was not very well and 5 was the highest. And the average score was 3.3, so similar to the online engagement survey. The most common response was 4, but I can tell you we got every score from 0 to 5. And as part of this question, we received a variety of suggestions on how to improve. And also, we got some appreciation from people for providing this opportunity to give feedback. So I think it just helped to reinforce that people were eager to have their voices heard. The question around effectiveness of communication has got some highly varied responses. Some people felt the communication was great, and other people felt the communication was dismal. So trying to take all of those into account overall, I think there was definitely the need to increase a sense of community and for us to adapt to modern technologies and be able to provide consistent quality information to the membership. There was a question related to how, if you were going to invite a friend to participate in Hemophilia Ontario, what would you say in the invitation? And that question was really around understanding how people would describe the organization and what aspects of the organization were valuable to them that they would use to encourage others to participate. So giving back and helping others was a big piece, as was being able to advocate for the community, and that this is a really timely opportunity to become involved with all of the advances in care. There's a lot of change happening, a lot of opportunity to do good work, and the importance of building and supporting a family environment. We asked, what do people need most from Hemophilia Ontario? And education and peer support were far and away the most popular answers. Also, to be able to provide a connection to other members, advocacy around the standards of care, providing support for pediatric to adult transitioning, and awareness for women with bleeding disorders and care. There was a question from Reframe Health Labs, which is a third-party for-profit organization that is it has been contracted by St. Michael's Hospital to develop a tool for communicating with their patients directly through the clinic. And when they heard we were having a focus group, they asked if we would include a question for them. So I did agree with the understanding that it would require separate consent and that all members of a focus group would need to consent to having that question shared with Reframe, or it wouldn't be asked at all. I don't know if I need to go over the feedback that we received other than to say, again, it was mixed. Some people didn't even think such a tool was necessary or a good idea. Other people felt it could be helpful. So we did collect a great deal of information and passed it on to them, which they were very grateful for. There was a question in the focus group about what's the appropriate balance for Hemophilia Ontario between online and in-person activities. And similar to questions around communication, there was no real consensus here. I think all of the participants mentioned the value of having face-to-face interactions and the need to develop relationships. But there were also a number of comments about the difficulty of attending events in person, about how they don't come to clinic or the city very often. So there was the issues about rural versus urban accessibility, and then the need to balance resources available with the impact created. So a lot of conversation around that events are great, but if you're spending a lot of time doing events where you only get 3 or 4 people showing up, then is it worth it? So there were a lot of considerations to be made in those areas. When we asked how Hemophilia Ontario should be reaching out to newly diagnosed families, there was some people who felt that it should be happening through the clinics. And so we had some questions and conversations around, privacy legislation and how we can share or not share certain types of information. So when it came down to it, there was really some desire to see us holding specialized events targeted specifically at newly diagnosed families, that we should be updating and revising our promotional materials and targeting some information specifically for newly diagnosed families, and also to offer information to the broader community. So helping people who are struggling through a new diagnosis to know how to explain it to a child's school or to a daycare or to aunts, uncles, grandparents. And again, the need for peer support groups, which came up again and again and again in a number of ways. We asked if they were in charge and could make one change to improve Hemophilia Ontario, what would it be? And so improved communication came up, to offer transparency at governance levels, to offer more family-friendly events, support for newly diagnosed families. Rebranding is specifically around the word hemophilia in our name. It came up more than once. It came up related to von Willebrand disease and other bleeding disorders, and not recognizing if Hemophilia Ontario and CHS are related to them and their needs. So they thought it might help us sort of expand our tent and get more members. Increased fundraising is important. I think a lot of people would like to see us doing more, and so they recognize the need to raise those funds, and stronger volunteer recognition is something that people would like to see. The last question that we asked was how your life was different because of your involvement with Hemophilia Ontario, and the answers in this area were overwhelmingly positive. I was really heartwarmed by a lot of the discussion and a lot of the stories that were shared. I think it really proved the impact that the organization has had over the years, but people spoke specifically about having improved health outcomes for themselves personally and for their family members. That because of Hemophilia Ontario, they felt educated and informed about what was happening, that it helped them to reduce their isolation, and it provided them a sense of community, a family, and in some cases, it literally provided them with their family. So the overall priorities coming out of the focus groups were the need for Hemophilia Ontario to grow our membership base, the importance of collaborating with the clinics, the idea to establish semi-annual events reaching out to newly diagnosed families, to reestablish mentoring or family matching programs, to try to ensure a bigger voice for Hemophilia Ontario at the CHS table, becoming more results focused and able to articulate what we've achieved, and the importance of sharing stories from the membership. So between the social summit and the online engagement survey and the focus groups, I think Maya's just going to give a little bit of a overall summary of the feedback that we received.
Thanks, Jenna. So yeah, I think if we're looking at overall feedback that we've kind of received from everyone, basically we're hearing that people are looking for things more locally, so more opportunities to access things in their own communities. That's really important. We're in a big province, so that's something that's of importance and is helpful to people. More face-to-face engagement is also something people are looking for. Support. So getting education and information that's relevant to their families, and there's a lot of things that are changing as in the bleeding disorders community. So that new education and information is important. Being able to reach out and connect and have opportunities to give back by supporting other families is something that is coming out of the information as well. And the last thing is growth. So we talked about fundraising, so increasing that, more volunteers, having better visibility, and increased community awareness. So those are the types of feedback overall that we've received.
Excellent. Thanks, Maya. So from all of those pieces, then it came time to start moving forward. which is why we are now going to lead into the conversation around the program plan preview and how we'll be turning the feedback that we've received actually into action. This is an overview of the program plan, and I know it's a lot on one slide, so don't worry, we're going to go through it in more detail. But it gives you an at-a-glance understanding about the investments that are happening into regional programs, provincial programs, youth programs, and other events and activities that we'll be holding in 2018. I'm just going to flip to talk about regional programs in general. At every level, at every conversation, and even in conversations I had either one-on-one or in small groups that weren't reflected as part of the overall engagement strategy, because I've been meeting with and talking to so many people over the past year. So in those conversations, as well as the three big engagement strategy events, we heard time and again that people wanted to see more happening locally at their community. So the board is actually making a really significant investment in staffing and program resources to be able to make that happen. We are going to be creating a new position for programming that's going to deliver programming equitably across the province. So there will be at least 3 events that are planned and implemented in every single region, so that people will have an opportunity to participate closer to home. There's going to be a mix of education and social opportunities. And really, we're hoping that this is going to facilitate better council involvement. As we moved away from the RSC model and councils were sort of loaded with responsibility in relation to planning and executing events, we saw some regions struggle with that more than others. And I think that on the whole, people, when I spoke to them about how they want to be involved, are looking for more flexibility. People don't want to be involved in the monthly meetings with a chair and a secretary and a governance manual necessarily. Not that there's anything wrong with that, you need those things. But we're hoping that by having some staff-led events, it will give people an opportunity to participate in ways that are meaningful to them without taking on, an ongoing responsibility related to serving on a council. Also included in regional programming is a brand new clinic attendance model. So whereas we've been, I don't want to say sporadic, but we haven't been hitting clinics equally in terms of where you will find Hemophilia Ontario staff attending clinics. We are now going to have one person whose full-time job it is to attend all the clinics across the province. And we're really hoping to be able to develop stronger relationships with our healthcare providers and to be more visible to the membership, including reaching out to those newly diagnosed families. Because if we're not meeting them at clinic, then it's really hard for us to sort of get them the information. We're putting the onus on the membership to try and find us, where it's really more incumbent upon us to be out looking for them. So that's where we're making those investments. So specifically related to regional programming in 2018, like I mentioned, you're going to have a new provincial programs person who's going to be implementing programs across the province. So the first one is we're going to have an education program related to peer support, and it's going to be tied to the RGM. So this will help to ensure that staff support is there to make sure that the RGMs are actually happening, and that it's not all being left to the volunteers, that there's some infrastructure there that the volunteers can rely upon to make sure that they have the support required. And the peer support education piece will be more around learning about what the program is and how and why you can be involved. And I'm going to talk a little bit more about what it is when we get to the provincial program section. We are going to have one of the education sessions that happens in every region be specifically about women's bleeding disorder care. Throughout the engagement process, we heard repeatedly that there needs to be more emphasis on women's care, and we did have W2 in 2017, and it was not as well attended as we would have liked. And one of the things that came up was the location, and that it was difficult to get the time to go away for the full weekend. And so we think that we can address some of the challenges around the W2 event by bringing some of the information directly to people where they live. And then we're also hoping one of the regional programs will be related to pediatric to adult transitions. So providing information specifically for parents and patients. It'll be planned with feedback from local clinics, because obviously every region is different. In some places the transition happens within the same institution. Some places you're moving from one hospital to another. So it'll be specific to the local needs. But also some general information about the process and things to keep in mind throughout. So now if we move to looking at the focus for the provincial programming, the board has really looked at how we can identify or target the identified priorities. So what we heard throughout the engagement process, how can we make sure that the programs that we're implementing really reflect the feedback received? We want to be able to do a couple of events really well, as opposed to trying to do a multitude of events where we don't get as much participation. So we're really looking to highlight inclusive opportunities to bring the community together, and keeping in mind that we are in an environment with decreasing revenues, and that also means less staff support. It wasn't possible to do all of the events that we wanted to do, including increasing the focus on regional activities. So we'd really like to make the best use of the resources that we have. But this also provincially will include continuing one-on-one member support services. So anybody across the province who requires support will have somebody who they can contact for referrals or for engagement opportunities. So when we look at the provincial programs, the first one I have on here is Reimagined Peer Support, and program name to be determined. And I really wanted to have one right now, and I don't still. I'm trying to think of something catchy and that gets the idea across more than just saying peer support. Hemophilia Ontario used to have a program called the Family Matching Program. And what I heard repeatedly throughout the year is that people would like to see the Family Matching Program come back. The Family Matching Program went away for a couple of reasons. And I think that we can address some of them by reimagining the program, really using an individualized approach with person-centered values, which I think it always had. But we will be requiring some very thorough volunteer training for people who want to participate in this program as a peer, with some really enhanced program infrastructure, including consent and understanding all of our various policies around confidentiality and direct healthcare advice and all of these other things, making sure that people understand the boundaries and also the responsibilities involved with providing peer support. And as part of that, we'll be offering an annual event where peers will be able to network, to meet each other, and to provide support to one another as well. The webinar series will be continuing in 2018. The education topics vary by interest and current priority, although with the current changes happening related to the CBS tender process, I think we are expecting some webinars related to products that will become available in the next year. And the webinars are great because it allows participation from anywhere. It says anywhere in Canada. You could participate anywhere in the world. And then if you aren't able to attend the webinar, you do have access to it after the fact on the Hemophilia Ontario YouTube channel as well. Community Camp is our flagship program at a provincial level, and we are really excited to make the commitment to bringing it on an annual basis. We are already talking with Wanakita. Wanakita have confirmed that we can have it annually. We would just need to move the date, so we're looking at what that means. But in 2018, it's going to be October for sure. That's guaranteed. And we're looking at how we can support having more families attend. It's also an opportunity for us to incorporate the Just the Guys program and some of the W2 activities. And it's not on here, oh, I guess it's the next one, but the youth engagement, because we'd also like to see some of the Hoy pieces come into community camp and have one large event for everyone in the community, where we can do some things all together and then some things broken out depending on personal interest. So we're looking forward to having more information about that coming soon. Provincially, we're also still delivering the financial assistance program. There is a revised eligibility policy that is in effect. We are now also accepting applications online and guaranteed faster turnaround on decision making. We've also connected with the clinics who've all agreed to distribute transportation and parking assistance directly. So hopefully that will make it easier for people who require emergency assistance in order to attend their appointments, because the clinics will be able to provide it to them without having to come back through Hemophilia Ontario. Blood Matters is continuing as a provincial program. It is moving to a primarily electronic resource. So in the past, what we've asked people to do is to opt out of receiving a hard copy. But when you receive your next issue, which is currently just in the process of being finalized and will be out within the next couple of weeks. But when you receive your next issue, you'll see in my letter that we are asking people now to opt in to receiving a hard copy. Otherwise, it'll be available online or through email only. And as we have been through the year, we'll continue to look at the content, really hoping to move the content more in the direction of upcoming research, new products, activities, and an increase in member stories. So from there in the program plan, we now come to our youth programming, which really the highlight or the most expensive program, which is also the highlight. If you look at all of the feedback that we've received throughout the year, it comes up again and again as the most valuable, would be Wanakita, which I hope you all know is the program where we send children ages 7 to 15 who are affected by a bleeding disorder to camp, where they are supported by nurses from the hemophilia treatment centers to learn self-infusion and really develop independence in their care. And also, as I mentioned earlier, it's an opportunity for them to develop peer networks and reduce some of that social isolation. This year, we're also working on Fresh Pine related to the Pinecrest Adventure Camp program. Emily McCormack, who's a longtime camper in that program, has joined us on staff for youth engagement that's been funded by the Ontario Trillium Foundation to design a new sustainable youth programming model. She'll be working on that throughout the year. And then around the time of Pinecrest 2018, we're hoping to be unveiling the results of the work that she's done and looking at what the new model will be moving forward. Ideally, whatever is designed is something that we'll be able to replicate in all of the regions, so that again, children, no matter where they live, will have the opportunity to participate in a similar activity or event. Hoy, Hemophilia Ontario Youth, does continue. However, staff-led events are on hold for 2018. So in the past, there have been things like the Jays game and other planning opportunities. What we've decided is to take the funds and start, I don't want to say hiding them, but to start saving them, reserving them. The youth have mentioned several times that what they really want to do is they really want to take a trip. And I've heard about the trip to Montreal, and apparently it was an awesome trip. So if that's what is really valuable to them, we want to make sure that we have the resources there to be able to do it. But we also think it's really important that the trip be reflective of the youth priorities and needs, which is why we're looking to have them be very involved in the planning and to really help them focus on program ownership and valuing their participation, not only that they value it, but also recognizing that it is valued by Hemophilia Ontario. We absolutely want their feedback and input and make sure that it's something that's important to them and not just something that they're coming out to help us, right? We want this to be valuable for them as well. So with that overview of our program plan, I'm going to turn it to Amy, and Amy can just give a little bit of a summary of what the board's vision and process was in creating this.
Okay, well, you haven't left too much for me to say. Other than I can say that this process was definitely a challenging one for all of us, especially because we've all been involved for such a long time, and we've all, you know, participated in many of these programs and maybe helped create some of these programs and have seen them, you know, throughout the years. So, you know, we really did take a step back and take a look at every single program in depth. We looked at how it met our goals and outcomes. We looked at to see if they were still serving the membership needs and the things that they're constantly asking us to help to serve them better. And we really did look at them under a microscope, and we went through each program and decided that we wanted to honor not only our history and where the programs came from, but also honor that our organization is moving forward and it's, you know, creating a new direction moving forward, and the organization is constantly changing as much as, you know, the world around it is changing. So we're really excited about the process. As difficult as it was, I remember the first time we went through the process, we were reluctant to make any changes whatsoever, but, you know, we're really excited about the changes that are moving forward and really excited to hear membership feedback and what they think about the program overview. And we're excited about, you know, moving forward and the vision that we see moving forward. And I'm just really excited to hear what everyone has to say tonight as well, now that they've seen it firsthand and in much more detail than I think we could have given in an issue of Blood Matters or in any other forum.
Great. Thank you, Amy. So on that note, as we look forward to where we are in the implementation phase, we're at the adapt stage. So we've listened over the past year. The board has made some decisions about a direction moving forward, and we're getting ready to adapt to what the feedback that we've received. And then part of that is the assessment. So I don't want anyone to feel that, well, we've, you know, gone out this year and we heard from the members, and so that's it, we're done listening. Like, now we know what you want and don't talk to us anymore. I don't know if anybody thinks that, but that's certainly not the intention. Member engagement is an ongoing process that we will be continuing to pursue at every level of the organization, continuing throughout 2018. So as we move forward with these new programs, please don't hesitate to let us know whenever you have questions, concerns, suggestions. It's always really, really valuable as we keep planning for how we want to move forward. So with that, I'd just like to thank everybody so much for coming and participating. Thanks to Amy and to Maya for being on the call. And at this point, if there are any questions, I think any of the three of us would be happy to answer them.
Hello, Jenna, can you hear me?
Hi, I can.
Okay, good. It's John LaPera from Tecumseh Call. How are you tonight?
Good, thanks. How are you?
Good. I have a couple of questions. I'm not really sure I understood a couple of the slides in terms of the annual community camp, where you were going to incorporate a larger annual event to just the guys with W2. What's W2?
Oh, the Women's Wellness Weekend.
Okay, so going forward, is just the guys being, I guess, taken out?
No, just the guys is being incorporated into community camp. So it will no longer be a separate standalone event. but it will be an opportunity to have similar activities and focus as part of the larger community camp event.
Okay, I'm sorry. Which larger event though?
So the community camp event that's traditionally happened every other year at Wanakita, where we invite the whole community. So it's not just for fathers and sons. However, within that larger community camp event, we will still have activities and education sessions similar to what you would have experienced at Just the Guys.
Okay, so you're going to incorporate the exact same kind of activities and exposure to those types of events just at a different place, but you're involving the rest of the community, is what you're saying?
Yes.
Well, I mean, the feedback would suggest that Just the Guys has been it was focused on, you know, fostering good relationships between children, being around other children. That this was like a well-attended event. So I'm a little surprised that you guys are putting this on the wayside. I looked at your numbers, and by looking at summer camps, those are all really good numbers, but I wouldn't say that summer camp with 48 total votes and Just the Guys 24, that would tell me that they thought that was pretty important. Based on 99, if there was only 99 people that did this, I find it hard to believe that Just the Guys is being put on the site.
Jenna, do you want me to jump in on this one as well?
Yeah, go ahead, Amy.
Yeah, so I understand where you're coming from, and Just the Guys is absolutely a successful event, and this was a conversation we had back and forth quite a bit. The focus of the Just the Guys weekend, as I'm sure you know, as an attendee for many years, is an opportunity for fathers outside of that primary caregiver role traditionally to have an opportunity with their sons to learn and experience that kind of one-on-one experience. And the more we talked about gender programming, and the more we realized that there was a lot of feedback as to why we have gender programming. And that also came up a lot with the Women's Weekend as well. We also had quite a bit of feedback from people that said that they would have liked to have attended Just the Guys or something similar, but they didn't have that male role model in their son's life. So they weren't able to attend, but they would have valued sending you know, like their neighbor or somebody who was that role model in their life, who wasn't that primary caregiver, but was still someone in their life. So the idea with amalgamating it isn't so much that it's not successful. It is. It's just recognizing that we're trying to be as inclusive as possible. So we're honoring the Just the Guys event by still having it, but we're changing its format. So the idea is, I'm not sure if you've attended community camp, but it's by far, I think, our most successful provincial program. It's definitely the most attended. During the day, there's a lot of opportunities for education and breakout. So our vision kind of moving forward is that we have our keynote speakers. So that could be medical professionals, it could be child life, it could be staff, it could be anyone. And then in our breakout sessions, that's where we offer those opportunities for our Just the Guys programming and our women's programming. But it keeps it a bit more inclusive. And it also kind of gives an opportunity for people to experience education or experiences like Just the Guys without keeping it as kind of focused and almost exclusive as it has been in the past.
What do you mean by exclusive?
Well, so for example, we did have a mother who said that, you know, she doesn't have a male role model for her son, and it was something she'd always wanted to send her son to, but it wasn't an opportunity. She didn't have any uncles or brothers that she could send her son to, so this opportunity was kind of missed by them, and it kind of had us talking about why we're offering gender-focused programming. Of course, the gender focus, I mean, as a very strong advocate for W2 myself, I had a very hard time amalgamating W2 with community camp. However, I realized that there's a lot that men can gain out of an event like W2 because there's a lot of misconception or misunderstanding or lack of education on women's needs. So opening it up to an event like community camp where there's greater exposure, it just helps educate and get people in that experience more often. So I understand that there is a lot of confusion as to why we did that, but it's not for lack of success. It's just kind of changing the face and, like I said, the vision of Just the Guys moving forward.
Okay, well, I'd like to go on the record like completely opposing what you guys are about to do here. This has, as you said, this has been extremely successful for, I don't know, 17, 20 years. And the fact that we had one person, the lady, that couldn't find somebody that was a role model for her son to attend shouldn't jump or shouldn't take precedence over all the other people that gained a huge benefit from it. It was
But why shouldn't she also gain from it is what our question is. What is it about the program that we can't also offer that opportunity to her as well? And she's not alone. I'm singling out an opportunity because it's our most recent, but it's not the only conversation that we've had to that caliber.
Okay, well, and I'm okay with that, but then let's offer her something. But I don't think you should just unilaterally remove this program.
We're not removing it. We are changing it.
No, you're not. You've in a kind, soft way have just reworded it, and you're going to join it with something else. So if you look at the history of Just the Guys, this is a shame that you're doing this.
I'm sorry you feel that way.
And
Yeah.
I know a lot of other people feel the same way.
Yeah. No, I hear you, John, and I understand absolutely where you're coming from. When we looked at the resources that were available, and I'm not even just talking about financial, but I'm talking about the staff time involved, it was a decision to invest more heavily in the local programming, which came up at every turn, people asking for more and more that they wanted to do locally. And so the board took the tack that we could invest in those resources, still have Just the Guys as part of the larger community camp event, and see if that addresses the needs of the community. If it doesn't, we want to hear that. And so please continue to participate throughout the year, and let us know if the programs that we're offering don't meet the needs as we hope they will.
Well, no, I'm glad that you're open to suggestions and that you want to do that. But I think, I mean, you have to remember, this is not just a one-off where you just had Just the Guys for 1 or 2 years. This has been going on since the early 2000s. So I think it's really important that everybody, there should be more dialogue, more consultation before this is just moved so quickly forward and moving it. There's been a lot of work done by a lot of people to get this program to a really, really successful point. And it is. It's a great event, a great weekend. If there's opportunities to, I guess, make it more gender neutral or to be more inclusive, maybe we should be exploring those avenues first before we just remove Just the Guys weekend. Again, this has been a core weekend for the last 15, 20 years, and I think you guys owe it to everybody that you have more consultation and more discussion on this before you just change it.
Okay. No, I hear that. Thank you, John. I can't see the chat window, so I'm not sure if there are any other questions or comments from anybody. So either Just the Guys Community Camp or anything else that we've discussed.
We haven't had any questions raised in the chat window, but certainly people are welcome to raise questions there. I think one of the, maybe I'll just bring one up, one observation just as looking at the attending list, and that is maybe just some general comments around the services and programs in the North.
To make comments about what we're planning?
Yeah, what's being planned for Northern Ontario going forward?
Absolutely. So we're planning to bring the regional programs. Sorry, I'm just looking for that slide. We're planning to bring these regional programs to every region, including Northern Ontario. So you could expect to see these specific events. In addition to activities planned by the council, this would be staff-led and supported events. happening in Northern Ontario. We're also looking at a program in partnership with Health Sciences North and the Thunder Bay Regional Health Sciences Center, specifically Dr. LaFerrier's program, although obviously we'd love to involve the pediatric department as well. In a program called VANES, it stands for Valuing Equity in Northern Services, and it's looking to really make a stronger investment in the services that we offer in the North, recognizing that there are some major gaps in what's available and the difficulty in providing service to such a large geographic area with some really specific needs. So we'd love to be able to invest more heavily in that, and we have made an application with those partners for a provincial Trillium funded project, which, if successful, will launch on April 1st, and we're hoping to get information about that program sometime in the new year.
Jenna, what's a person-centered program, or sorry, a person-centered value?
So it's looking at, sorry, I'm just trying to find that slide too. So person-centered values are looking at the person first and not the disease or the issue. So always approaching something with the person in mind, and making sure that your comments and your suggestions, and because this is in the frame of providing peer support, so that it's not a cookie cutter approach. It's not one size fits all. And so it's recognizing that what has worked for you is not necessarily going to work for the person you're supporting, and being able to actively listen and make sure that you're reflecting on the individual person's needs.
If you don't mind, I'll just indulge another question. I see you're planning on continuing with the webinars. I was just wondering how attendance for the webinars has been in 2017.
It fluctuates really depending on the topic. The ones that have a stronger medical focus receive the most participation. So we had a presentation by Dr. Carcao on extended half-life therapies that Matthew can correct me, but I think was the most attended one that we've offered this year. We also had great participation in the pain management webinar with Dr. Susan Tupper. It's hard to say because they also get views online after the fact, but I think that we're averaging 10 to 15 participants per webinar. Matthew, is that correct?
Yeah, it is actually, and probably our average is a little closer to 15 than 10, but yes, it's been as few as 7 and as many as 29.
I'll indulge in one more and then I'll be quiet. On the point of improving communication, where there have been changes proposed to the program plan for established programs, if there has been a planning group involved in those programs, have they been consulted yet, or will that be part of the process before the program plan is approved? And a follow-up on that question is, have you considered, with any significant changes to programs, to run it as a pilot project for a year without a long-term commitment to the changes?
So the planning group around Just the Guys and W2 were not consulted because I think the board felt that the programs weren't being eliminated, that they're being continued as part of the larger community camp, and so we hoped to still involve them in the planning of the activities at community camp with relation to those traditional programs. And I think that as I said before, this is part of a process where we're hoping to listen, adapt, and assess. And so if the assessment after 1 year is that there's a need to return, I don't think that's something that people would automatically rule out. I think that we'd be open to considering everything in conjunction with the needs of delivering more programming at a local level based on the feedback that we've also received. Are there any other questions or comments?
It's John again. Sorry, I had sent a message through this chat here. I was just looking for confirmation. Is there going to be any more dialogue with all the members before making these changes? Specifically eliminating Just the Guys event.
Right. So the position of the board is that Just the Guys hasn't been eliminated. I understand what you're saying in your perspective.
So I'm hearing a lot of background noise.
Yeah, me too. And Matthew, can you mute all the mics except me? Sorry. So again, I think the position of the board is that Just the Guys hasn't been eliminated, although I do understand where you're coming from. The budget has been passed for 2018. We're still in a conversation with our pharma partners, because obviously their support for these programs is essential. Having spoken, I would say, I don't want to say off the record because it was on the record, but unofficially with Bayer, is that they're actually potentially excited about the opportunity of making Just the Guys part of a larger province-wide initiative. So I feel that the support is going to be there to offer it this way this year. And then what it means moving forward will depend on the feedback that we receive.
Well, I mean, you feel like it's going to be successful going forward, but did we get feedback from, like, I know Paul asked the question from the program committee members, the planning members. I mean, it would be nice if everybody was involved just to provide a little bit more information to really, vet through everything in terms of the value that it's provided, the programs to all of these boys and girls, to families and everybody for the last 20 years. I think this is way too quick in moving forward, and I strongly feel that. I just don't understand how we can eliminate an event so quickly in a matter of like a couple of months.
It's Maya. So I just wanted to, just trying to reiterate, I guess, that we as the board really don't feel we're eliminating this event. We in no way want to get rid of it, because we do recognize the value of Just the Guys, but we also had to take a good look at all of our programs and really look closely at attendance over the last several years, and noting that our community camp is so strongly attended. It's doing very, very well and involves a lot more people. We wanted to be able to do Just the Guys, but involve that into a greater, the greater community as well. So we do still want to have that style of event included into that event as well. So it in no way is being eliminated at all. And and our communication with our funders is still that is still going to be available, like the activities that are provided at that are still going to be included, because we do recognize the importance of it. But at the end of the day too, we have to look at our revenues and our budget and what is affordable to do as a province, and we want to be able to provide for as many people as we can.
in designing what this program could potentially look like in the future, Jenna, is there a role that you see for volunteers who have previously been involved in Just the Guys to help shape what this new program may look like?
Yep. No, absolutely. And I'm sorry, I thought that I already mentioned that the plan was absolutely to involve the existing committee as we move forward. So
Hello, it's
Matthew,
John
please
again.
mute all.
Hello, sorry, Jenna?
Yes, hi, John.
It's John again. So I just want to go back to the previous conversation we had before I sent this email chat message here. My understanding was that there would be more dialogue, and that you said that it's not confirmed. So could there be opportunities for more of that dialogue to happen, to have some sessions to talk about the viability of Just the Guys and how it's going to move forward?
So what I said is that absolutely we want to involve the planning committee. Absolutely we want to get feedback, and we want to hear about the success, or I don't want to use the word failures, but let's say lack of success of the programs that we implement this year. The board has passed a budget for 2018 that does not allow for 2 separate weekends. So the plan is to have one weekend that will include Just the Guys activities as part of a community camp event. And if that is not successful, we absolutely want to hear that and to reflect on that moving forward. But the budget for 2018 does not have room for 2 events.
Okay, so if you're going to make a larger event, does this mean that we'll need more funding from the stakeholders and from volunteers? I mean, because you said just based on the numbers and based on, like, is there fiscal restraints that won't allow for? I mean, how are you going to make a larger event if you're having a hard time making one event?
Well, because traditionally in 2018 we would have had 2 events. Traditionally in 2018 there would be Just the Guys and there would be a separate community camp event. So the budget that the board has passed includes one larger event that it is larger than the budget for like a separate Just the Guys event, but it is smaller than having 2 separate.
Now, correct me if I'm wrong, but was Just the Guys not fully funded through the pharmaceuticals?
It was in terms of the support provided for the events and activities, but what has never been included in any of the program budgets, and this isn't specific to Just the Guys, this is across the board, it has never accounted for the staff time involved in the planning, the execution. And so when we look at how we structure our budget, it's not only in terms of the dollars, but it's in terms of the human resources as well. And how many hours of work can we support, and how many events can we deliver, and really deliver at the highest level of quality. Because as I mentioned, the board was very clear that they're not trying to do every event, at a level of okayness. What they'd really like to do is they'd like to focus on delivering a few very key, just premier or sort of
flagship.
Thank you. Flagship event. That's exactly the word I'm looking for.
Oh,
so that's the direction they're moving.
And I understand that, but you had that in Just the Guys. It was a refined event. It was to the point where it was so well run. It was well attended. It was very popular. If you look at the post-event reports, all the things that come back year after year, they took that seriously. They brought it back to the planning committee, and there were always good changes put in, great education sessions, I mean, I can go on and on for hours about this.
No,
but
I agree,
I
John.
just,
I was the guys this
I just want to say that it was a very refined program, and it was already a very beneficial program to all of its members.
Yeah, no, John, I absolutely agree. I was at Just the Guys this year. I saw the benefit to the people who participated. I think that it had a really strong history, and I think that it did a lot of good. And I think that moving forward, we'd still like to see that continue. We think that that can be part of the community camp event, because really what we're looking at is inclusive opportunities. So, for example, some of the men who don't have children have indicated that they would be interested in attending. Amy's mentioned, single moms. We have had Just the Guys in the north, and it's always been combined with a family camp environment. And earlier when you said that the committee would consider opening up Just the Guys to be more inclusive, I'm heartened by that, because I really think that that's what community camp is. And I really think that we can keep all of the things that you love about this program, and it might look a little bit different. And I understand that not everybody's going to respond well to that change. All I'm asking is that you can be honest with us over the year about what works and what doesn't work, and we'll see the changes that we make as a result after that.
I understand. I'm saddened, but I understand.
Oh, I know you are, John, and I would be more than happy to continue to have this conversation with you. Like, if you want to meet face to face, I'm happy to meet wherever's convenient for you, or you want to talk to me over the phone or send me an email. Like, I really do want to get this feedback, not just from you, but from everybody. I really do want to hear it, because I really do want to make sure that our programs and services reflect the needs of the members. I think it's really, really critical that we are open to hearing everything good and bad, so that we can have our programs and services sort of mirror back to the community the feedback that they're giving us. But what I can say is, what we have heard is the need for more local. People want to see things happening in their community. And in order to increase that, we needed to look at where we could make amalgamations in other areas. I hope that you will see that it's not going away. It's just going to look a little bit different. But please, by all means, reach out to me with any concerns that you have, either in the near future or further down the road as this unfolds. So with that in mind, and it is now 8:15, if anyone has any questions about anything other than community camp, I would be really happy to answer those. Otherwise, I would just encourage people to reflect on what we've spoken about tonight. And like I mentioned, please do not hesitate to reach out to me. And I'm sure the board would like to hear your feedback too. This, again, like I said, membership engagement isn't one and done. It's going to continue all year long. And we would really like to make sure that we get it right moving forward, whatever that may be.
Thanks, Jenna. And I think the one other comment is for all those that have registered, this webinar has been recorded, like the others in the series in 2017. And you can look for it being posted on our YouTube channel shortly. With that, I think I'd like to thank everyone for your participation this evening. Thanks for being part of it, and we look forward to bringing a webinar series to you in 2018 as well. Thanks, and have a good evening.
Thanks, everyone.
Thank you.
Jen, are you still on the line?
Yeah,
And
I am.
Amy and Maya? Sorry, I got muted out before, but I did try to say after my questions, thanks a lot. I think that this is really kind of exciting that you guys have done this consultation process, that you're reaching out